Hello everyone, here we'll try to learn about the skin. Structure of the skin. The skin is the outermost layer of the body that serves as a protective cover for the body. It acts as a partition between the internal and external environments of the body. With its all appendages, skin is also called as an integument. For its many secretory and synthetic function, it is also called as an organ of the body. As it covers the whole body part, it is considered as the largest organ of the body. The total weight of the skin is about 3.5 kgs. Skin is a close contact with the external environment, therefore, skin is immediately affected by the changes in the environment. And skin plays also important role in providing non-specific immunity to the body. Layers of skin. The skin is divided into two main layers, epidermis and dermis. Epidermis. The epidermis is formed by stratified squamous epithelium and it contains further 5 layers. From superficial to deep, there are as follows. They are stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum germinativum, that is stratum basale. All the layers of epidermis are present in the skin of all parts of the body. However, there is some modification of the skin of palm and sole. There are no blood vessels in epidermis. Stratum corneum. It is composed of dead cells containing keratin. The nuclei are almost absent in many cells and they are continuously shed off from skin, and it is particularly thick in palm and sole where the skin is thicker than other parts of the body. Stratum lucidum. Stratum lucidum appears so homologous throughout. It is composed of flattened cells that contain ellatin, a protein which is precursor of the keratin. These cells degenerate and migrate superficially to form stratum corneum. Stratum granulosum layer contains cells that rich in granules. The granules are formed by keratophyllin. This layer consists of multiple layers of rhomboidal cells. Stratum spinosum is formed by multiple layers of polyhedral cells called prickle cells due to the presence of spine-like processes on their surfaces. These cells migrate toward the surface, forming the 3 superficial layers to it, one after another. The Langerhans cells that participate in defense mechanism are present in this layer. Stratum germinativum is the deepest layer of the epidermis. This is also called as stratum basale. Cells are arranged in a single layer on basement membrane. Active mitosis occurs in the cells of this layer and cells gradually shift through the above 4 layers towards the surface. Melanocytes, the cells that synthesize and secretes melanin, are present in this layer of the skin. Melanocytes have melanosomes and melanin granules that are located only in the cytoplasmic or dendritic processes. Tyrosin plays important role in melanin synthesis in melanocytes. Tyrosinase converts tyrosin into 3,4-dihydrophenylalanine, that is DOPA, which is converted into melanin through a series of biochemical reactions. Melanin is stored in vesicles formed by Golgi complex in melanocytes and secreted by exocytosis. Dermis is the inner layer of the skin. Many glands, hair follicles, and few smooth muscles along with fibroblasts and histiocytes are present in the dermis. Dermis is composed of again 2 layers, superficial papillary layer and deep reticular layer. Papillary layer is a compact layer that forms the papillae. Papillae from this layer project into epidermis. The papillae contain blood vessels, nerve endings, and lymphatics. The reticular layer consists of fat and loose areolar tissue impregnated with the reticular and elastic fibers. This layer merges with the subcutaneous layer of the fat and binds the skin with deeper structures. This diagram shows the different layers, that is epidermis, dermis, and hypodermis, And further, it shows that 5 different layers of epidermis: stratum corneum, lucidum, granulosum, spinosum, and basale. Glands in the skin. The glands in the skin are mainly the sweat glands and sebaceous glands. Sweat glands are present in all over the skin except in eardrum, lips, and glans penis, and they are of two types: merocrine and apocrine glands. Merocrine glands, these are known as eccrine glands. They are present in the skin all over the body. They are simple tubular glands. The tubules of the gland are very long and coiled. These glands form a usual sweat glands in the skin and are usually present in large number. Thus, sweat is formed mainly from eccrine glands. Following injury, cells from these glands also contribute to regeneration of the skin. The apocrine glands are present on the mons pubis, axilla, circumanal area, and areola of the breast. The ceruminous and mammillary glands belong to this category of cutaneous glands. The secretion from these glands starts after puberty and impart characteristic odor to the body. Sebaceous glands. Sebaceous glands are smaller pear-shaped alveolar glands. They open at the hair follicles or directly to the skin. Obstruction of the secretion of these glands is responsible for acne formation, which is seen at puberty due to the increased activity of dihydroepiandrosterone. This structure showing the different glands, sweat glands, the eccrine glands and apocrine glands. Eccrine glands, they were mainly responsible for the formation of the sweat, whereas the sebaceous glands, which are oval shaped, and they are responsible for formation of the sebum, and obstruction to the hair follicle can form acne. The blood supply of the skin varies between 1 to 150 ml per 100 gram of tissue. On average, it is about 13 ml per 100 gram of tissue, which accounts about 460 ml per minute through the entire cutaneous circulation. Skin appendages. Skin appendages include hairs and nails. Types of the hair, different types of hair are seen in fetus and in postnatal life. On the body of the fetus, hairs are soft that are called as lanugo hairs. After birth, two types of hair cells are seen, that is vellus and terminal hairs. Vellus hairs are soft hairs found on the body of infants and children, whereas terminal hairs grow during puberty and replace vellus hairs of childhood. However, vellus hairs persist on the face of adult females. Parts of hair. Hair is a keratinized thread developed from epidermis. It has a shaft that projects outside the skin, a root that remains within the skin, and a deeper part is called as hair bulb, which is embedded in the hair follicle. It is indented below by connective tissue papilla. If you see the structure, it has medulla, cortex, and cuticle. Medulla is the central part of the hair. It is formed of cuboidal cells at the root and are confined towards shaft. The cortex is formed of cells in the medulla. Cuticle is the outermost layer and formed of a single layer of the cell. The hair follicle consists of an epithelial root sheath which is continuous with the stratum germinativum. A connective tissue sheath is present around the follicle. The erector pylorem muscle is attached to the follicle. Contraction of this muscle causes erection of the hair during sympathetic stimulation. Sebaceous glands also open to the hair follicle. Nails are modified skin at the tip of the digits. Nail consists of root, a body, and free margin. The root is continuous with the stratum germinativum layer of the epidermis. In fact, constant proliferation of the cells from stratum basale, continuous growth of the nail occurs. These cells in the nail become flat and keratinized. Functions of the skin. Body protection. Skin is the outer covering that forms a protective layer on the body, and it provides mechanical protection against infection. Thus, the body is protected from toxic materials in the environment. It is important for maintenance of temperature regulation. Secretion of sweat contributes significantly to temperature regulation. It causes evaporation of the water from skin. Skin also allows insensible perspiration, which helps in temperature regulation. Sebum, the secretion of sebaceous gland, makes the skin greasy that prevent skin from drying. They act as sensory organs. There are many sensory receptors in skin which are called as extroreceptors that help to collect information from the environment. Hair follicles are rich in such receptors. Therefore, hairs are more sensitive sensory structures. All types of receptors such as pain, touch, temperature are present in the skin. It is responsible for vitamin synthesis. In exposure to sunlight, the skin synthesizes 7-dehydrocholesterol, the precursor of vitamin D. It helps in contribution to the central blood volume. Cutaneous vascular bed accommodates a good quantity of blood volume. In circulatory shock, the blood is diverted from cutaneous and splanchnic bed to the cerebral and coronary circulation to perfusion of the brain and heart respectively. This is achieved by sympathetic vasoconstriction, an immediate compensatory mechanism activated by shock. Also, cutaneous vasoconstriction or dilation plays a very important role in temperature regulation. Helps in water and electrolyte balance. Sweat is secreted from the skin, contains water and salt. Hence, excessive sweating leads to dehydration and sodium deficiency. Hormones like aldosterone affect water and electrolyte excretion from skin. Sweat also acts as a medium for excretion of waste materials from the body. It helps in protection from UV rays. Skin protects the body against damaging effects of UV rays of sunlight. Melanin pigment in the skin helps in this process. It helps in immune process. Sebum secreted from sebaceous gland is acidic and contains microbial agents. Plasmocytes in the skin are the cells of mononuclear phagocyte system that trap and kill organism. Therefore, loss of skin as occurs in burns or injury allows pathogenic bacteria to enter body, which produces septicemia if uncontrolled. Acts as a route for the drug administration. Many lipid-soluble drugs, steroids, fat-soluble vitamins are applied over the skin. However, drugs are used as subcutaneous implants when their release into circulation is required at a lower rate over a period of months or years. Estrogen, progesterone, contraceptive implants are such examples. They help in the diagnosis of some diseases. Apart from skin diseases, many diagnostic signs of systemic disease are recorded from the skin surfaces. Thank you.